Welcome to another episode of the Health by James newscast. I bring you the most relevant and uncensored medical news. If you'd like to follow along word for word, there's a link in the description. Also, please remember to like and subscribe. So, I would like you to look at the image directly on the screen. You likely are already. It says HBJ Newscast, Episode 1, welcome. And the three items to the right are what we will be talking about today. So the first one is a newer CDC masking study that's getting a lot of attention right now, a lot of attention. And we'll examine exactly why. Second, the AAP flip-flopped on masking guidance for kids, and they're getting a lot of heat for that. That's also a very important topic we will cover today. Also, college COVID vaccine mandates we will cover. Now, the title of today's newscast is Newer CDC Study Shows Masking Provides No Meaningful Reduction in Viral Transmission. American Academy of Pediatrics flip-flops on masking kids. 867 colleges still have COVID vaccine mandates. So first, let's briefly cover each topic before diving deeper. Here's what you likely missed over the last 24 hours. A resurfaced CDC masking study revealed nearly no benefit for those who masked against respiratory infections. AAP, the American Academy of Pediatrics, flip-flopped on masking kids, and new college data explained how many students will return to campuses with COVID vaccine mandates soon. Find out which ones. To begin, a newer study posted in CDC's Emerging Infectious Diseases Journal in May of 2020 named Non-Pharmaceutical Measures for Pandemic Influenza in Non-Healthcare Settings, Personal Protective and Environmental Measures, brought to light the truth about masking against respiratory viruses, that being masking against influenza, like most small-sized respiratory viruses, including SARS-CoV-2, is ineffective at reducing transmission. Next, AAP, the American Academy of Pediatrics, said in 2018, kids with visual impairments are slower to develop than kids without visual impairments. To explain, if a child cannot see an individual's face clearly, then the learning or communication experience is truncated and therefore development is impeded. This is common sense. Now, fast forward to 8/26 of 2022. AAP, the American Academy of Pediatrics, said masking, which creates an obvious physical barrier, does not impede language development. Now, there is no meaningful data to support that claim. That means AAP is now politically flip-flopping on masking. Now, on to colleges. There are still over 800 colleges and academic degree-granting institutes with COVID-19 vaccine mandates students will be returning to soon. Nonetheless, there is no science to suggest mandating healthy young college kids, likely who already have had Omicron, and then boosting on top of that reduces their risk of severe disease or death or campus transmission of the virus. So now that we've generally covered each topic, let's go a little deeper into this. So let's get back to that CDC masking study. A systematic review hosted by CDC of 10 RCTs, or randomized controlled trials, revealed masking was ineffective against meaningfully reducing the transmission of respiratory influenza virus. If masks work, why don't they? So, looking at the image on the screen here now, there are two yellow highlighted areas, right? The first one I'll read. In our systemic review, we identified 10 RCTs, or randomized control trials, that reported estimates of the effectiveness of face masks in reducing lab-confirmed influenza virus. So let's go now little further down to the second sentence that's highlighted in yellow. We found no significant reduction in influenza transmission with the use of face masks. So you see here it says RR. Next to that is 95% CI, which is a 95% confidence interval. It's the likelihood of that being repeated, that result or those results being repeated within a certain range, which is next. The range is 0.51. That's the lower bound confidence interval. So 0.51 through the other end of all these results, which is 1.20. And as you look further down here, you see P. That's the p-value, the statistical significance of the finding, which is 0.25. So what they're saying is all of that I just said within the past 20 seconds is essentially identical to people who don't mask. So the stats are nearly exactly the same because there's no difference between people who mask and don't mask against influenza, or I should say respiratory viruses. So, moving on. The other day, on 8/26/22, AAP, the American Academy of Pediatrics, said, quote, visually impaired children develop speech and language at the same rate, end quote. Therefore, the implication of the aforementioned statement was that masking kids, or even adults, cannot be associated with harms. Ironically, AAP's own publication from 2018 in Developmental and Behavioral Pediatrics stated children, quote, with severe visual impairments are slower to acquire adjectives and verbs, end quote. So there's a huge contradiction. What changed? Clearly, the AAP has become a political arm and needs to be rebuilt. So if you look at the image below here, at the top it says AAP, the American Academy of Pediatrics. Now on the left-hand side, clearly, is a tweet. This tweet was posted at 3:05 p.m. on August 26th of 2022. And it says, quote, if caregivers are wearing masks, does that harm kids' language development? No. There is no evidence of this. And we know even visually impaired children develop speech and language at the same rate as their peers. Now that's in 2022. Let's turn the clock back to 2018. I'm going to read the first sentence on the far right here. Compared with sighted children, those with severe visual impairments are slower to acquire adjectives and verbs, have more prolonged phases of echolaic speech, are more likely to choose more egocentric topics to discuss, and have longer periods of pronoun confusion and reversals. So it's kind of funny, the irony here. On the one hand, they say that masking doesn't do anything. That's the implication, that masking does not harm development because it's simply not a barrier that would impede a child from learning or communicating. But on the other hand, back in 2018, the antithesis is clearly true. So they're obviously flip-flopping. Moving on. Of the nearly 4,000 degree-granting colleges and universities in the U.S., 867 still have COVID vaccine mandates in place. This is poor policy because there is no data to show vaccinating healthy kids meaningfully reduces their risk of severe outcomes from COVID-19. So if you look at the image here, the title of the image is 867 colleges and university campuses still having COVID vaccination mandates as of August 24th, 2022. The source is from bestcolleges.com, and it's broken down by state, and then it gives the number of institutions by state. So the top 4 with mandates, right? As you guessed it, New York, ranks in at 169 total institutions. California is 98. Massachusetts, that's where I'm from. It's like the mecca of healthcare. So that's to be expected. That's 73. And surprisingly, Illinois, although it's very democratic, however, I would have thought other places, nonetheless, they rank at 66. Now, moving on. The last order of very important business, monkeypox update, right? So, global monkeypox case count for the week, August 15th through August 21, 2022, was 5,929, which was a 20% decrease from the previous week, where 7,477 cases were documented. The three most affected countries by case count are the United States, 15,877 cases. Number 2, Spain, 6,284. Number 3, Brazil, 3,984. Now, of all cases reported globally between August 15th and August 21, 2022, 98.2% of those monkeypox cases were male. 77.7% of males were aged 18 through 44. 95.6% were men who had sex with men. 1.1% were bisexual men. 43.9% were HIV positive. And 84% of transmission was associated with sexual transmission. So if you look at the image below here, there's a monkeypox graph on the left and a chart on the right. I'd like to draw your attention to the right because it's almost, I don't want to say itemized, but for lack of a better term, it lays out all of the stats that I just laid out. If you look, very interesting, you see there's a healthcare worker column, and 4.9% of healthcare workers ended up testing positive, at least in this study. So that's very important. Now, that sums up all of the data that's important anyway that surfaced over the past 24 hours. And that's most certainly some of the most important news that broke. And that concludes this podcast. So you stay safe, and I'll see you on the next one.